What's up? It's your favorite NP, and welcome back to my channel. I know it's been a minute, but your girl is back, your favorite NP. As you can see by the title, this is just an update regarding my previous video I made about a year ago, talking about the new entry level for nurse practitioners being DNP and no longer MSN. If you're new to this channel, my name is Harriet. I am a nocturnal nurse practitioner. I practice with hospital medicine, going now on 8 years. So this video, like I said, is an update on the push for obtaining your Doctorate of Nursing practice when becoming a nurse practitioner. If you had not watched my video, I will link it above. It takes a deeper dive into details of becoming a DNP, what to expect when you obtain a DNP, like the years of school, etc. But to give a brief overview on this topic, it has been proposed again that the new entry level when becoming a nurse practitioner should be the Doctorate of Nursing practice and no longer the Master of Nursing Science. So getting your doctorate versus getting your master's when becoming a nurse practitioner. So to further explain, this is actually the second time. It was proposed back in 2004 that the American Association of College of Nursing recommended that NPs be required to earn their DNP, with the goal to make the requirement effective in 2015, but no state license commission adapted the DNP standard, and less than a quarter of schools training advanced practice registered nurses even offered the degree. They did some studies back then, and during that time showed that while many schools added the DNP programs, they also kept the Masters of Science option when becoming a nurse practitioner. And it basically, they just seen that a lot of people gravitated to obtaining their Masters of Science and not much of the DNP program, because they kept both. So both was still an option, and a lot of employers at that time didn't make the change as a necessity to obtain or to have your DNP. That push for it back in 2015, the change did not occur, obviously. So fast forward to 2018, the NONPF announced that we will push to make DNP the new minimum level of education for certified nurse practitioners by 2025. What year is it? Today, to be exact, it's February 18th. 2025, the change has not been officially made yet. One reason that I found interesting for this push to obtain your DNP is that currently there's a lot of us who hold our Master of Science of Nursing. We're going up against other professionals who actually require their doctorate. So for example, our fellow nurse anesthetists back in 2009, they required all nurse anesthetist programs to transition to their doctorate level. So by 2023, all new students that enrolled was obtaining their doctorate. To reach the goal by 2025 this year, all new graduated nurse anesthetists will have their doctorate. As well as pharmacists. I have back in 1997 to 1999, that's when their change occurred, that they require all students to obtain their PharmD. If any pharmacists are watching this video, please correct me if that year is wrong. But yes, I know pharmacists now are required to obtain their PharmD. And then as well as physical therapists. Physical therapists, back in January of 2016, the Commission on Accreditation of Physical Therapy Education made their Doctorate of Physical Therapy the required degree for all their accredited entry-level physical therapist educational programs. Basically, it's just saying that we're kind of like all on the same level when it comes to professions. They are obtaining their doctorate. Nurse practitioners, we're still at the master's level. So going up against, we're not going up against, but just our fellow professions who are similarly on our professional level are obtaining their doctorate. We're just trying to give us that push and get us on the same level as other professions. Other reasons for the big push, the increase in complexity of care for our patients is just growing. Our patients are sicker. There's multiple comorbidities that we're managing now. Secondly, it's the rapid expansion of knowledge underlying the practice in general. It's the national concern of quality of care and patient safety. And hearing this, that just made me think of nurse practitioners pushing for full autonomy, right? Again, we're talking about the quality of care and patient safety when we're caring for these patients. There's a lot of states already that have full autonomy, meaning they do not have to collaborate with a physician. There's a lot of NPs that are pushing for it. My question is, are they a DNP prepared NP for all of the states to come on board and provide full practice autonomy? Because right now I believe there's only 26 or 27 states that have full practice autonomy. Will there be a push that these NPs are DNP prepared? So there's so many questions. My question is, like, as a patient, maybe you're a family member, you're taking them into, or you're trying to find a new primary care provider. Would you want a DNP prepared nurse practitioner to care for your loved ones versus would you want a master's prepared NP to care for your loved ones? And then in choosing which one, at the level of them having full autonomy, would you want a DNP prepared NP that has full autonomy? She is not collaborating with the physician versus a master's prepared NP that is practicing with full autonomy. This is just a broad question. I feel like a lot of people will move towards the doctorate. It's just for it being the name, not looking into the schooling. I personally do not know the difference between the clinical difference between a DNP prepared NP versus a master's. Obviously, they're saying there's going to be more that is clinically learned. Right now, I have several DNP prepared NPs that are practicing clinically. Like what they're doing, I could do their job too. And I'm just a master's prepared NP, if you get what I'm saying. Is there a big clinical difference when you're obtaining your DNP? Granted, like I said, I don't know. If you are a DNP prepared NP, please let me know. Leave a comment below if there's a big difference. Who will really tell a person? Like, I guess if I right now, if I have my MSN, if I go back to school, what is going to be different in the teaching clinical wise when caring for patients? That's my question. When asking around my colleagues, a lot of them feel, they say like there's not going to be a difference. My question is, how big is the difference clinical wise? I will link the video talking in more depth of the benefits of DNP, but DNP is more administrative, more leadership work. If you're considering leaving bedside and not, practicing clinically, becoming like the chief nursing officer or at a management level, this is where a lot of people look at when you do have your doctorate. We feel, as well as I myself feel like it's more of the leadership world when you hear DNP. I'm speaking for my master's prepared NPs. When we hear DNP, we feel it's more administrative leadership role and not a big jump clinical wise. Please leave a comment if you are DNP prepared, still practicing clinically. Is there a big difference? I mean, if you work with other coworkers that are master's prepared, is there a big difference clinically? But I'm getting carried away. So another advantage, it's saying having advanced clinical skills. Again, I need to see the curriculum. What is going to be different from what I was taught in school? Clinically, is there going to be a big difference? They're saying it is. So other advantages will be increasing earning potential. Again, the leadership aspect and leadership opportunities that you could have when you obtain your DNP. Disadvantages, it's common sense. The length of school, it's going to be longer. It's going to be like 3 years to obtain your nurse practitioner degree if you go full-time, and then it could be up to 4 years if you're part-time. And then increase in costs. So obviously the more years is going to be more expensive. And do people want to do that? I feel with those two things, the increase in length of school and the cost of schooling, it's going to lower the number of applicants. Another point I do want to make, they're projecting the growth of NPs to be about 28% by 2028. They're saying about 62,000 NPs. Will we see an increase, or would this number decrease significantly with the changes? Ultimately, it needs to be a big collaborative effort for this change to occur across all states. We're talking about the universities, educational institutions, employers, certification agencies, and again, like the state licensing boards, all need to come into agreement for this change to occur simultaneously, all at once. As of today, recording of this video, no, the change has not been made. Yes, it's going to take some time. Do we know? Is it going to be within this year? Is it going to be within the next 1 to 2 years or the next 5 years? Maybe. We just don't know. And I'm just here to keep you guys informed, keep you guys updated, because I don't want you to be surprised, because this is a big change. The movement is going to be slow. Like I mentioned, with all the collaborative efforts, a lot of people need to get on board and agree to these changes. And again, it's going to vary by state. Will current master's prepared NPs be grandfathered in, or will it be something like, I think it was the BSN to 10 that occurred in New York. Basically all BSN, all associate's degree nursing, they were required to obtain their bachelor's science of nursing within 10 years. Will it be something like that is required for current master's prepared nursing practicing right now to obtain my DNP within the next 10 years? We just don't know. There's still a lot of questions, but know that the push is still there. The push is still there. And like I said, I just don't want it to be a surprise, because what if you guys are thinking about moving states? What if right now the current state that you're in is not with the big change, right? So you're still practicing as a master's level prepared NP, but you're planning on moving, and the state that you're moving to require DNP prepared NPs. And it's like, even the employers, what if the employers is like DNP prepared only? You won't be able to obtain a job. Another thing to consider is with the higher salaries DNP prepared NPs could earn, reportedly around $9,000. Employers may not be excited about this because, right, like employers hire us because we're more affordable. We're a more affordable alternative than medical doctors. I will continue to update you as I gather more information, but I don't think this will be a big change across all states. This will be slowly implemented state by state, just like practicing with full autonomy. Like I said, right now there's about 26 or 27 states with full practice autonomy. So this nears the end of this video, and you guys know I love to end my videos with a Bible verse, and today the Bible verse is John 14 verse 27. And the verse reads, "Peace I leave with you, my peace I give to you. I do not give to you as the world gives. Do not let your hearts be troubled, and do not be afraid." I experienced the peace that you get from the Lord, and when I tell you, it's the best feeling in the world. You're unbothered. The peace is just a feeling of just comfort, that I am okay and I will always be okay. And know that you cannot feel this peace from the worldly things. You cannot. This peace is only felt from the Lord. But you have to know the Lord. You have to open your heart. You have to soften your heart. You have to be like him. You have to want to be like him to experience this peace. He wants you to give him your fears, your worries, your doubts, your thoughts, your what if, all that. He wants you to give it to him in exchange for this peace. And that's when I say that you get this feeling of being unbothered. You're not fearful. You're not afraid to any and every situation. So I pray that you guys find a way to give the Lord your fears, give the Lord your worries, give it to him in exchange for peace. Like I said, the peace that you experience is not like the peace you can obtain from this world. It's not. And when I say once you experience this peace, it's the best thing that could have ever happened to you. Stay tuned for the next couple videos. I'll be talking about which state to actually have full practice autonomy, burnout. So yeah, stay tuned. Leave your thoughts, your questions below in the comments. Give this video a thumbs up. Subscribe if you're not already subscribed. And until next time.